Is it right to always endorse fatty liver or steatotic liver disease as a manifestation of Medo Vruddhi just because Western medical science defines it as a condition of increased fatty buildup in the liver? Is it possible to successfully manage all cases of fatty liver by using Medohara Rukshoshna Aushadhas, even when the patient is extremely emaciated? No. Here is a case study with successful management of fatty liver in a patient who was Krisha and Durbala without targeting the Medus at all. Let's get in. A male patient who was aged 58 years and who was teacher by profession had consulted for being detected to have grade 1 fatty liver while getting his abdominopelvic USG done for his general health checkup. Though the major concern of the patient was this sonological finding of fatty liver, a detailed interrogation with the patient revealed that he was suffering from many other ailments, which were as follows. Patient had recurrent episodes of amlaka, that is sore belching, udgara bahulya, excess burping, occasional episodes of brahma, giddiness, shrama, easy fatigue, glani, easy irritability, asyapaka, that is mouth ulcers, and severe raukshata of tvacha, that is excessive dryness of skin, since many years, but all these were said to be increased since past 6 months. Along with these ailments, he had other ailments too, which were recurrent episodes of daha yukta sarakta mutra pravriti, that is burning micturition associated with hematuria, and shola daha yukta mala pravritti, that is painful defecation associated with burning sensation in the anal region since 4 months. The findings of Trividha Pariksha advocated by Ayurveda, that is Darshana, Sparshana and Prashna, were as follows. The patient was Krisha and was of Ruksha Prakriti, that is his Sharira was very Krisha and Ruksha. The patient was Durbala and Sukumara by nature. And it was observed by history taking that patient had a very long history of atisevana of betel leaves with tobacco and lime, that is 5 to 6 times per day since many years. He also had long history of atisevana of pickle, which is kshara in nature. And the prakriti of patient was assessed as vata pittala. Though the major concern of the patient was the sonological finding of fatty liver, neither diagnosis nor treatment was centered around that sonological finding. Instead, based on the findings of parikshas advocated by Ayurveda, the Nidana Purvaka Samprakti in this case was found out to be so. Atisevana of Ruksha Ushna Dravyas, that is lime, tobacco, etc., had led to Vata Pitta Prakopa with Atishaya Vruddhi of Rukshoshna Gunas in this patient. This coupled with Vata Pitta Pradhana Prakriti of patient had led to all the symptoms, that is Amlaka, Udgara Bahulya, Brahma, Shrama, Glani, Asyapaka, severe Raukshata of Tvacha, especially Dahayukta Sarakta Mutra Pravritti and Shola Dahayukta Mala Pravritti. And all of these are the cardinal symptoms of Vata Pittaja Rakta Dushti. So when all the symptoms and signs are found out to be the outcome of Vata Pittaja Rakta Dushti in this case, what is fatty liver in this case? Is it just Medo Vruddhi? And what should be the treatment in this case? Should it be Medohara drugs and Rukshoshna formulation even after knowing that the patient is very krisha and durbala? No. The samprapti of fatty liver in this case was so. Vata pittaja rakta dushti, which had happened by increased rukshoshna gunas, had led to vilayana of medas in this case, and there was random movement of this abadha medas by vata, which was already in prakupita avastha, eventually leading to vimarga gamana of abadha medas and making it get entry into yakrat, which is moola of raktavaha srotas. So, excess fat which was observed in liver in this case was secondary to vimarga gamana of abadha medas and not at all due to Medo Vruddhi in this case. And as all were the consequences of Vata Pitta Rakta Dushti, with main manifestation in Raktavaha Srotomula, that is Yakrit, excess intake of Rukshoshna Gunas was found to be the Nidana in this case. So based on all these entities, Snigdha Sheta Rakta Pitta Hare Chikitsa was planned in this case and not any treatment which was targeting Medo Vahasrotas. That is, 2 cycles of Yoga Basti with gap of 3 months with Yashtimadu Kashaya and Kshira for Niroha Basti and Yashtimadu Taila for Anuvasana Basti, followed by intake of Shaman Aushadis, that is Patoladigrata in Samanavata Kala thrice daily, Draksha Kashaya in Apanavata Kala thrice daily. And the ahara vihara of patient was advised to be so. Patient was advised to do nitya abhyanga with yashti madhutaila. He was advised to have milk and resins daily. And patient was advised to completely restrain from rukshoshna ahara. And the outcome of this treatment was so. Amlaka, Udgara Bahulya, Shrama, Glani was completely pacified after first cycle of Basti and few days after intake of other medicines. Asyapaka, Raukshata of Tvacha, Dahayukta Mutra Pravritti and Shula Dahayukta Mala Pravritti was reduced after 2 cycles of Basti and regular intake of other medicines. And for special note, USG findings of patient turned completely normal only after 10 months of treatment. So, the lesson from this case is, every sonological finding might not be a distinct vyadhi according to Ayurveda always. Instead, it could just be a reflection of any phenomenon of samprapti of the main existing vyadhi. Example, fatty liver in this case. So does this mean fatty liver is always a manifestation of vilayana of abadha medas in all cases? We'll try to answer this question with another case study of fatty liver in my next video. Stay connected. Thank you for now.